Hi, Constashif Donovan as Grogan's Pharmacy Stadingen. Today I'm going to have a bit of a chat about cold and flus. Common cold and seasonal flu are caused by viruses, which means they cannot be treated with antibiotics. They need to run their course. Effective treatments over the counter can be a big help. The early symptoms in colds and flus are similar. In colds, initially it's an upper respiratory tract infection, so the nose, throat and upper chest, expecting a cold to last from 5 to 7 days. A flu covers the whole body. Symptoms are more severe, and about a flu it's often likely to linger for up to 2 weeks. Usually there's some relief in the symptoms after a week. In a cold, an increased temperature slightly occurs, whereas in a flu it's more severe. Sweating, shivering, aches and pains, headaches and generally feeling unwell. If you're still able to function despite discomfort, it usually means cold, whereas in a flu you're more likely to be bedridden for a couple of days. Catching colds and flus are caused by viruses, so usually pass on by sneezing, spluttering or coughing droplets in the air. So ideal breeding grounds would be creches, Montessori's, buses, waiting rooms. So different treatment options to try and relieve symptoms would be paracetamol and norepinephrine for pain relief. The paracetamol, you're taking 1 or 2 tablets 3 to 4 times a day, not more than 8 a day. It's important not to exceed the recommended daily dosage, as this can be dangerous and can cause liver damage. It's important to also watch any other cold and flu remedies you may be using, like Lemsip and Uniflu would also contain paracetamol, so it's important not to be overdosing. That way, ibuprofen can help with fever and body aches and pains, which are symptoms associated with flu rather than a cold. They help to make you more comfortable. If you're experiencing symptoms of cold and flu, it's important to stay hydrated. Your appetite may be reduced, so by drinking plenty of fluids, it helps to improve your appetite again. It's important to avoid caffeine and alcohol-based products. This may lead to further dehydration. If a cough is one of your symptoms, different cough treatments can be effective. It can be productive, which is a chesty or a phlegmy cough, or non-productive, which would be a dry, tickly cough. Linolin, for example, has a range of cough syrups which can treat dry or chesty along with the decongestion. But the Linolin phlegm is an effective one. So drinking plenty of fluids just to replace everything that's lost through sweating is important in both. If you have blocked nose or nasal irritation, the saline rinses can be an effective method to remove any harmful bacteria. Blocked nose is a direct result of swelling of the nasal passages due to infection, so in children this can be alleviated using saline drops. In adults, there's a range of decongestion sprays which work within minutes to help you to breathe easier. Different throat lozenges can help. So sore throats usually caused by an infection, bacterial or viral, usually accompanied by a headache or a cough. When you feel it coming on, it's important to act. By effective treatment can mean that it's gone or reduced after 5 to 6 days. So using the likes of strepsils or gargling aspirin or paracetamol can be effective to rest your voice and avoid smoky areas. Diflam or Septibene sprays are effective as an anti-inflammatory and antiseptic benefits. They can be used in children over 6 and in adults. Other effective treatments to fight a cold and flu can be taking the likes of vitamin C. Echinacea can be a good one. If you're generally feeling healthy, you're most likely just to feel rotten with a cold and flu. It won't develop further complications and require hospitalization. However, if you have a weakened immune system or chronic illness, flus can be fatal. Emergency is another one that's good to help increase your immunity, and it also helps to keep you hydrated and help to fight colds and flus. Shall I finish?